So today we are going to talk about self-harm and how it impacts individuals who may be experiencing some stress related to all kinds of life stressors, job stressors, family stressors. And this is a way, it's what we call a maladaptive coping skill. So it is a way to relieve internal stress. It's a way to outwardly express what we're feeling internally, because some people do not have the ability or the words to do so externally to someone else. And so this is what we call a maladaptive coping skill. So we have non-suicidal self-injury, and then or NSSI, and then we also do have suicidal ideation. Non-suicidal self-injury, this can lead to suicidal ideation, but not always. Non-suicidal self-injury, it just can be that the person wants an outlet, and so they may cut themselves, they may burn themselves, hitting, punching themselves or others, but this does not necessarily mean that they're suicidal. A lot of times when children engage in self-harm, it is a signal that, like I said, they don't necessarily want to harm themselves. Maybe they do, but not often. It's just more for children, a signal of emotional distress. Any change in a child's behavior, whether they're becoming more isolated or the reverse of that, if they're becoming more outgoing, so any change in what the child's typical behavior is. Also, as far as physical signs, we want to look for any marks, any scarring, definitely self-isolating, maybe not reaching out to friends via, social media apps, maybe sleeping more, or on the reverse of that, sleeping less. Then also reporting feeling down. Now, children a lot of times won't report this to parents. So also I would encourage parents to reach out to the school to see if there is any noticeable change in behavior in that environment as well, because a lot of times parents may not notice that their child is experiencing distress because they're so used to the child coming home, doing their thing, whatever their routine is, and then so you might not notice it at home, but other people who are around the child more hours of the day may notice a difference. So reaching out to school professionals is important as well. And I would also encourage parents to have a conversation about this, because this is a very serious issue. And just encourage your children to know that they have an open and safe space to come to. That, being a teenager is hard. So I think validating that is very, very important. And then also, if they're not comfortable talking to mom and dad, that they do have school counselors and us here as well. So they internally want to relieve emotional distress for themselves, because like I said, they don't know a better way to manage it at that time. But there is also a sense of shame that goes along with it. It's kind of like a cycle. We have the trigger, then we have the plan of how they're going to harm themselves. But then as soon as they complete the act, the cycle starts over again. They have shame because they've done it, and then they also have shame because they're continuing to hide it as well. And so it's really important that we don't be punitive to our children, and we don't minimize their concerns, but we make sure to take those concerns seriously, because we all want to keep our children safe, and we all want them to know that there are other ways to manage stress without going that length. Whatever area that you're in, you can contact the 988. That's the mental health crisis line. That is the equivalent of 911 for medical emergencies. So in Cape, we do have the Behavioral Health Crisis Center, and then we do have the Southeast Behavioral Hospital for psychiatric hospitalization. And then we also do have Community Counseling Center. We do have crisis staff. One cool thing about crisis staff is they do have people on call every day, so that there is someone there all the time that you can talk to.